So if we look into interventions or treating sleep, again, we're not looking at this as necessarily treating something like insomnia as a diagnosis, but we're addressing sleep as part of the recovery system. So when sleep impacts function, tissue healing, pain modulation, or adherence, again, this is well within our wheelhouse. This is our bread and butter. We got to talk about it. And this is absolutely billable under existing therapeutic codes, and we'll get to that. So, we can reinforce CBT or cognitive behavioral therapy in insomnia principles. So this revolves around things like stimulus control, screen time, consistency, just like with exercises, reduced in-bed wake time. So are we working in bed? Are we scrolling through our phone in bed? All these things that mentally deter us from being able to be in a place mentally where our brain and our system is ready for sleep. And, exercise is great. It remains, according to, when we look at some of the evidence, one of the strongest sleep interventions we can utilize. Aerobic, resistance, mind-body type exercises, these all improve sleep efficiency. Of course, the one thing we should be mindful of is not doing high intensity type work right before bed. Probably, have like a good 2 to 3 hours perhaps of not doing intensive weight training, not doing sprints, not something that really upregulates our system while we're trying to wind down those last couple hours of the night. So something that we know too about sleep is that it has a significant therapeutic effect on pain sensitivity and outcomes, and vice versa. So again, pain, something we deal with or work with, I should say, every single day, and sleep is super important with that. And finally, we can prescribe environmental changes and wind down rituals the same way that we dose movement. We can say, like, let's make this specific, consistent, and measurable, just like exercise.